if like the same information from the CAS before mom got to the hospital, the hospital then cross-references every pregnant woman that comes in with this master list of alerts they get. If they see her name, they automatically cross the CAS.
Yes. So, what happens is child welfare is mandated from the day somebody is born until 18 minus a day. Okay? So if you are someone, if you're working with someone who's expecting, there is no child. Therefore, child welfare cannot be involved because there is no child, and their mandates the child. So a lot of different children's aid societies have a position called a PAC worker, which is a pregnancy and aftercare worker. That worker is someone who can work voluntarily with a expecting mother. It doesn't matter if it's the first child or the umpteenth. It depends on for that specific child. And that expectant mother can say, yeah, you know what, I'll work with whatever service you can help me out with, so that I can be the best possible mother when this baby comes into the world. Or you can have an expectant mother who says, no, thank you. Now, if that expectant mother, if there are concerns for that expectant mother, let's just say drug concerns, or there are mental health concerns, or there's transient issues, or there has been intimate partner violence issues, anything that, you know, would pick up on a coding, if like they would pick up with child welfare if that child was already here, what that pregnancy and aftercare worker would do, consult their supervisor and say, you know what, we really think the baby may be at risk once they're born, especially if it's drugs or mental health stuff. We're gonna send an alert out to the hospital. And if we have an idea that expectant mom is about 3 to 4 months pregnant, we're gonna send out an alert that would say start anywhere within the next 3 months for the next, say, 6 months, because you can deliver at any point in time within the 6 months period if you think she's about 3 to 4. And it goes out to all hospitals across the GTA. And what will happen is when this woman shows up to give birth, the nurses will cross-reference her name to see if they have her name on a list of alerts for child welfare. And if they do, they will call the Children's Aid Society for that jurisdiction she's shown up in. So you could have an expectant mother who was, let's say, Toronto CS was trying to work with. She says, no, thank you, but Toronto CS has concerns. They will send hospital alerts to everywhere up to like the Simcoe County area. And if her name shows up on a list in, say she shows up in Peel and delivers, Peel CS has to go out and deal with it because she's in Peel, that's where the baby is. Toronto has no jurisdictional power to deal with anything. Same if it's someone they've delivered, they're from Peel, they've delivered in Durham, Durham's got to go and figure out what's going on. I saw a hand halfway up, yes?
So what's the mechanism to run the name? Presumably they don't run every pregnant woman.
They don't run every pregnant woman. Usually if a woman maybe has come into the hospital and appears to be under some type of influence of a substance, sometimes it's a mom who's delivered before, and some hospitals do know that this particular mom's had previous CAS involvement. They'll check her name again. Some hospitals do ask if the mom's had child welfare involvement before. And if mom says, well, no, this is my first child, but a CAS worker tried to call me, but I didn't have a kid at that time, they'll go and check their name. Yes?
We will actually cross-reference everything.
Okay. So that's a lot of work, but they will cross-reference everybody, right? List, yeah. Yep. Because you can show up anywhere. And so for some moms who are who have been involved with child welfare before, they will give a fake name, they'll show up without their health card, and then they'll deliver and they'll go home with their baby. Right?
So is that an automatic apprehension?
Not necessarily. It depends on what's going on at that time. So the concern could have been, say, at 3 months that, let's just say the concern is substance issues, right? And by the time delivery day comes, mom's now delivered and mom states to the doctor or the nurse or whatever, this is the community agency I've been working with. I did have some issues with substances, but I've been quote unquote clean, or I've been sober for this amount of time. Child welfare worker comes in and they see that the strengths and that the mother is quote unquote prepared for her child. She's got family support and she's got the materialistic resources in place for this child. You're not going to really have much of a leg on to stand on in terms of apprehension. You're going to more be able to say, okay, so you may still be able to be a little bit, you're going to have the opportunity to hopefully work with this mom so that everything can continue to keep going well. And you may not be, child welfare may not need to be involved for a long period of time, but they are going to want to check to make sure things are going well and this child's healthy. Does that give everybody a decent understanding of the alert piece, if that happens? Yes? Yes? Okay, great. Yes?
In terms of like record keeping,
Mm-hmm.
how long does that information stay with the hospital?
It expires. So it's going to expire, and you might be able to speak better to this. But if it's safe for the next 6 months, at the end of 6 months, it's gone. So if they've delivered early, or say they've delivered late, it could be that they've delivered a week late. The alert's no longer valid. Like it depending on the hospital and how they keep their records, they may tear up those letters. I don't know, because I never worked in a hospital.
I actually don't know the specifics of what happens.
Mhm.
I know, and I've seen the alerts. I don't know how the end dates work. I know that they give it an approximate due date. Potentially, maybe they want that to be the expiration date. But yeah, I don't know how long. We have a specific staff member who does it. And
Yeah.
I don't know when she clears it.
It gets cleared out. In the province of Ontario, 99 years. The question was, how long are child welfare records kept in the province of Ontario? And the answer is 99 years. In the province of Quebec, they're kept for 5. Mm-hmm. Yeah. Different sides of the spectrum. Yeah.
So is that even if someone calls, provides the name, and they don't open the file?
99 years. Yes, Carrie? Yes, Carrie?
Talk about maybe some of the challenges or overrepresentation that comes from hospitals into CAS
Mm-hmm.
and reporting that way.
So in terms of the challenges and overrepresentation, we live in a society that is multicultural. We live in a society where people come here with their own practices. So when you come here with your own practices and you meet a social worker or nursing staff who does not understand or know about your practices, they may see them as odd. They may see the new mom as non-compliant. They may see her as early signs of postpartum. They may see a lot of different things and think that this is a concern for maybe her mental health. Or you may see a mom who shows up and she doesn't have a partner with her. A partner could be a man or a woman. You don't see any family with her. Oh, she's socially isolated. That's a concern. Or she's a young mom. That's a concern. Or she didn't know she was pregnant. That's a concern. Or she didn't come prepared with anything. That's a concern. She didn't have a car seat. That's a concern. So all of those things, they pick up and call the phone. They pick up the phone and they'll call Children's Aid. Because as a social worker in a hospital, if mom didn't have a car seat, maybe the one she ordered didn't come in yet, and the baby came 2 weeks early. How about you pick up the phone and try to find her a car seat? Why are you calling Children's Aid? Right? Or how about you get an understanding if she has some type of a cultural practice after giving birth? Figure that out first before you just say, oh, it must be she doesn't understand and she must have some form of mental health, or postpartum's kicking in early or quickly. We need to call somebody. Or if it's a young mom, find out who she has as supports before just saying, oh, she's a young mom, she must be isolated. We need to call somebody. Right? So those are the nuggets of information, the tidbits that you can share as community-based agencies working with these families so that they're more prepared when they go in. I've always told the young moms that I work with, you have to do things twice as much because they're looking at you twice as hard. So if that means you're a mom and you've got your kid packed up for daycare, put in 2 sets of change clothes versus just 1 set of change clothes. Put in 3 or 4 times the amount of diapers versus just putting in 3 or 4. Put in 2 extra snacks instead of just the 1 snack because they're going to look at your child first. right? Right? And like we shouldn't have to work that hard. If our white counterparts are able to just send the one set of clothes, the one snack, the one of this and that, why can't we do the same? But we're looked at harder. We're looked at more. Over scrutinized, over surveillanced. That's what currently happens in our society. So we have to work twice as hard to be seen just as good to then not have a concern. So if the child welfare agency is going to call the daycare, oh yeah, she's always prepared. There's plenty of stuff here at the daycare for her child. Great. Because then that speaks to this parent being engaged with the daycare and always being prepared to ensure their child has their needs met. Right? Instead of, oh, well, a couple times we've had to go look in the lost and found to try to get something for the child to wear because the child had an accident, because they're potty training, and not everything goes perfect every day of the week when we're potty training. Right? Or the child seems to be hungry and the one snack mom provided isn't enough. So we have to continually give the child extra. Right? So it's those kind of comments that then increase the surveillance of our young moms and dads, of our parents, period, that then start to lead to assumptions, which then lead to phone calls. Sometimes phone calls just for clarification, but the fact is it's leading to a phone call. Okay? So investigations. So this is kind of how things are broken down. So after initial screenings to check on a child, Child Welfare Society, Children's Aid Societies, CAS, might decide to get more information about the child's situation. This is called a formal investigation. Depending on the risk of the immediate harm to the child. So remember when I showed you the eligibility spectrum in that first column, which was the darkest of gray? That's our highest risk column. That's what's going to decide how quick you go out on how quick child welfare goes out on investigations. And the investigation needs to be started and completed within a 30-day period. But again, that's 30 days including weekends, and child welfare does not work on weekends. So as part of an investigation, CAS workers must meet with the child, and they usually speak to the child alone. Part of that being, if we want to ensure a child's safe, we need to hear what the truth is. Therefore, they want to speak to a child on their own so that the child can feel comfortable to say whatever it is they want to say, if they have anything to say in the first place. Some kids have nothing to say, and some kids will say, I don't want to talk to you. Okay. I can't force a child to talk to me because that's not being very child-centered. Or you have some kids who will tell you about everything under the sun just because it's great to talk to somebody new. We have some kids who, they'll go to school, a CS worker will show up, they'll talk to the worker, they'll go home. Anything happened at school today? No, school is fine. But then by now the child welfare workers left a message for the mother or the father, and they'll go back, did somebody come and talk to you at school today? Yeah. Why didn't you tell me? I don't know. And that's a favorite answer of kids. I don't know, fine, it was good. I think all of us as parents can say we've heard those answers. As kids, we gave those answers. Because in our minds, just like, yeah, nothing out of the ordinary happened. Or a parent will say to the kid, what's the person's name? I don't know. Okay, sure. One of my coworkers, the grandparent said to the child, what color is the lady? Is she white? No. Is she black? No. What color is she? She's peach. But that's because this is someone who's white, who has more of an olivey skin tone, so that's the color the kid matched the adult to, right? Or I remember I had one kid, their mother said, I asked her what your name was and she said she didn't know, but you were wearing a necklace that said Judy. So, yeah, that was my name, so that's what the kid said, I don't know what her name was. Like, okay. But these are our kids, right? So as part of the investigation, they'll meet with the child alone. They'll also speak with the parents and the child's caregiver. So just because you're the parent does not mean you may necessarily be the caregiver, and just because you're the caregiver does not necessarily mean you are the parent. In this day and age, we have grandmas, grandpas, uncles, adult cousins who are raising kids, especially within our community. Everybody's kind of got their hand in the pot because everybody can bring some type of value to a child's life. So then we have here, children's aid workers may also speak to child siblings or other children in the home. They may be speaking to other adults living in the home. So again, where I talk about the idea of you have an aunt or an uncle or an adult cousin who also lives in the home, that can be seen as a strength. That's part of your network. That is part of a family's, maybe it's part of their supervision model. I once had a call where the teacher's telling me that the child's family seems sketchy, and I said, why? Well, there's someone different every day bringing the child to school or picking the kid up. I go, who? Well, one day it's grandma or grandpa or aunt or uncle or the dad or the mom. So I said, so there's a large network of support around this child? Well, and that's kind of where it ended, because I've kind of just stumped this teacher, because in her mind, the fact that all these different family members drop or pick off this kid, and the kid's happy to see everybody runs, hugs, jumps, smiles, but it's sketchy because it's not the exact same person coming to get the child every day of the week. Well, maybe mom works and mom and dad work more than 1 or 2 jobs, or someone's in school and grandma and grandpa are retired, or they don't work, period, or they're up visiting for a few months, and so they try to help as much as possible, because when they go back home to wherever home is, they're not there, so they're trying to do as much now and pay as much attention to the child. But it's sketchy because that wasn't her frame of reference of what pickup and drop off should look like for a child, because this is a black child and this was a teacher who was not. Yes, my sister.
Is speaking to a tenant a problem?
Right? No.
No? Isn't there an invasion of, isn't there?
If they're living in the home, they may know what's going on. They may not know. If they don't know what's going on, you're not going to involve them. But if they know what's going on, and usually when it comes to investigations, collaterals, as we call them, so people who can speak to the parenting of the mom or the dad, or the mom and the mom or the dad, they want to speak up in terms of, these are the good things this parent or parents do with this child. So they want to try and lend their voice to be helpful. Or they may now be part of the safety plan for that child, so the child doesn't have to leave the home. But it's, again, who have you checked in with? Or do the parents say, go and talk to my so-and-so, go and talk to my tenant, talk to my neighbor, talk to my this, right? You end up checking that with the parent, because you do need some form of consent. I've had parents call like their best friend, talk to them right now on the phone. Okay, and they pass me the cell phone. Sure, no problem. Because if that's someone who's a strength in your network around your child, I'm all for it.
So speaking with the tenant would be with parents' consent? Is that
Yes.
what you said?
Oh yes.
Okay, that's different.
Oh yeah. Oh yes. Oh yes. And then so anyone who saw what was reported to CAS. So if there's someone who, if it's an issue around drugs, or it's an issue around mental health, or it's an issue around abandonment or physical discipline, if someone else saw that, the child welfare worker can make an attempt to speak to them, or they can attempt to speak to the child welfare worker. And then we have any professionals who work with the child, such as their doctors, counselors, teachers, daycare workers, or any support staff within the school board.
Sorry,
Yes.
So what happens if mom refused to allow you to speak to the child?
Refuse to allow to speak to the child. So although child welfare tries to take the least intrusive measure, when roadblocks come up for child welfare, they have to become more intrusive in the way that they get to their bottom line of finding out what's going on. So unfortunately, there's more than one conversation with the parent trying to figure out, why do you not want me to speak to your child? What's going on there? But if that continues to be the roadblock, there's the possibility of court involvement to get your investigation completed. And I'll be very clear, no one wants to go to court. No one ever wants to go to court. I've never met a child welfare worker in 15 years that says I like going to court. Because court comes with a lot more court forms and affidavits and a whole different section of the system that nobody wants to be entangled with. Because if you jump into the court system, it's not you as the worker or you as the parent that can say, okay, we're done with the court system. It's a judge. So that comes now out of everybody's hands on, say, that kind of front line level, and it's now in the hands of a judge. Nobody wants that. So if you look into your booklets on page 9 and 10, we do talk about who are our mandated referrers. So before, when I mentioned that idea of duty to report, we have our mandated referrers. Pardon?
That was my inside voice.
Oh, okay.
You said child and youth workers aren't there.
No, they're not listed, but they can still be listed under teachers. So you have your doctors, right? So children see doctors. That's where they go in for possibly their vaccinations. Usually they're seen for the first year of life every couple of months, and then every so often for shots. You have your nurses, daycare staff. Daycare staff and teachers, those are the two professions that literally see your kids all day long. Straight possibly from 7:30 in the morning, straight till 6 o'clock in the evening. They have the children all day. They're gonna know by, I'll say middle of October, they know these kids pretty well. They know good days, bad days. They know the look, the trouble, the silence. They start to be able to pick up on those things, right? Family counselors that are involved with families, the school social workers or social workers in community-based agencies, religious leaders, and then, as my friend over here said, you have your child and youth workers that are in the school board or in the hospital. All of these are professionals, and they are mandated to make referrals to the child welfare sector if they have a concern for a child. They do not have to have verified evidence, or they do not have to have that this has happened at this time. They have to have the concern that this is the possibility that this child's safety may be jeopardized. Okay? And so when it comes to our Black youth, who then are sitting in schools, or they've gone to the daycare, they're seen it, they're looked at. So just like I said, how I tell my mothers, pack twice as much so that you're seen as just as good. And for our teachers, ensuring that, you know what, tell our parents, engage with the schools. Find out when parent-teacher night is, show up at parent-teacher night. If you have the opportunity, if our parents have the opportunity to say volunteer at the school, volunteer at the school. Because those pieces, and the more visible our parents are, that's gonna create a positive narrative about them, right? So that when if the school has to call, and the child welfare agency that is connected to that particular jurisdiction is working from a strength-based perspective, and they are going to hopefully be asking the question of, tell me what else can you tell me about this family? Well, mom and dad are at the school, they are there for parent-teacher night, they help the kid bring in their schoolwork, the kid's always on time, the parent calls if the child's gonna be late. Those are the kind of things that start to feed into the investigations, which are then going to start to change the trajectory of how families are treated and possibly the outcomes of their files, because this is an engaged parent. So what's going on that this happened? Or this is child number 4, and the child welfare system's never heard of the first 3 children, so what's going on here, right? So then you have a parent or a set of parents where they've had 3 other children in the educational system, they've never called on one of those 3 kids, child number 4, and there's something going on. So that's a strength that they've never had to call on the other 3 kids. And that's a strength that mom or dad are always at the school for parent-teacher night, or they volunteer on a school trip. Like, all of those things speak to being engaged as a parent, right? They said the child may have A, B, or C, and the parent wants to know what can they do to support their child. All those narratives help when it then comes to if someone has to make a call. Do you understand what I'm talking about there? Okay. But please understand that as a mandated referrer, everybody in this room is a mandated referrer. And just because if you are not a professional, you still have a duty to report, but there's more, you're held to a higher standard or a different standard if you're a professional, because part of being a professional is being in a field or a realm where you're supposed to be helping to improve society and improve the outcomes for children. So if you see something's happened to a child, or you think something's happened to a child and you didn't call, where are you on times of how do we keep kids safe? So we're gonna talk a bit about the education. So when it comes to the educational system, there's something called teacher's bias. And I think probably a lot of us in the room who are of African Canadian descent have either gone to school with a roti, a hard bread sandwich, or a patty, okay? And so when I did telephone screening at one point in time, I had a teacher call, and it was a teacher calling me for a school that was in a priority neighborhood. And it was a teacher who was not African Canadian, I could tell by the last name. And the teacher said they were calling to consult. And I said, okay, what do you think is going on? Well, I'm concerned about the child's nutritional needs. And I said, okay, well, why? Because the child brings a patty to school for lunch. So I said, okay, what's the concern? Well, I don't think that's nutritious enough. And I go, so what's the difference between that and 2 pieces of bread and some prosciutto? Or between a panzo, or pierogies, or samosas? because those are all like kind of the same thing. Some type of stuffing and some carb. And so that wasn't a referral, but that's because I knew, like I asked other questions around, does the kid have lunch every day, other things, and everything was positive. It's just that she thought the child bringing in patties wasn't nutritious enough. But it's the exact same thing as putting some type of a cured meat in between 2 pieces of bread and sending your kid out the door. Right? And but if it was a counterpart of mine who may not have that same understanding, they may have thought it was an issue. And then it could be the kid who brings their lunch to school, and I don't think the lunch is nutritious enough, and they're always late for school, or sometimes they don't have the appropriate clothing on for school given the weather. And then you start to kind of see a picture being painted about, well, what's going on with this family? Right? And then it's, well, moms come in sometimes or dads come in sometimes, and they sometimes tend to be upset with the teacher or with the school. Or they can be seen sometimes talking a little firmly to their child. And then concerns kind of start to develop. Do you see how that can turn into a phone call against a family? And really and truly, it could be that, yes, they're speaking firm to the child because this is the 3rd morning in a row that the child won't get up on time to get ready to come to school. And they've been telling them time and time again. And because they didn't get up on time to get to school, they have on their running shoes instead of their winter boots because mom or dad said, let's go, we've got to go, everybody's late, right? And so, it could be a series of unfortunate events that have happened for a couple of days or over the span of a couple of weeks, which now turn into a concern for the child and what's going on at home. So then as intake screening workers, they have to take that apart to see, is there really a child protection concern, or is it about assumptions based on the family that then have to be picked apart to show that there's really not a concern? So that's also something in terms of trait reporting. So like picking at the little things in terms of a family and making those into reports. Cultural gaps. So for this teacher who thought that patty was inappropriate, there's a culture gap because that teacher didn't have a very good understanding of the difference in cultures. Because the panzerotti can be about this big, a patty is always about this size, unless you get the cocktail, right? But it's the same thing. You bake it, you fry it, you put some stuff in it, and you sit down and you eat it, right? We look at different parenting styles. So again, I stated around, you have the white mother who may be passionate and organized and can self-advocate for herself and for her children. And then you have the African Canadian mother who is aggressive, always questioning authority, strict, firm, militant. So it's the way in which these people are being looked at, right? Because any mother who's concerned about their child's education, who's concerned about the way their child's being treated at school, that's someone who's advocating. But if you look at it through a lens that takes their color and their socioeconomic status into account, that's where we then end up with concerns about the parent and the way that they address the school. Or concerns with the family in terms of the way they organize themselves and the kid always showing up late to school, or any number of things. And then we look at things like the microaggressions. And that would be, microaggression would be around what I mentioned, the family where the teacher says that the family seems sketchy because there's always different people dropping off the child. But it's the child's family who's dropping off the child. So why is that sketchy? I have a nephew. My nephew has 5 adults in his life who at any point in time can do all of the primary caregiving roles for him. That's a child with supports. That's not a child with a sketchy network. That's a child with a strong network. Right? And so on one hand, how can having a support system be seen as sketchy, and on the other hand, it can be seen as something that's great and it can help to keep your children safe? All right, so those type of microaggressions. Or, well, how do they spell their name? That can be seen as a microaggression. Right? Those are just 2 small examples. And then the over-reporting. So out of everything I've just named about in terms of food and the microaggressions and cultural gaps and misunderstandings, all of those things then lead up to over-surveillance and over-reporting of Black families. Meanwhile, they're just trying to get through their day. Now, granted, in some cases, yes, child welfare needs to be called, but that is not every case in which child welfare needs to be called.